Right then, this session is mainly focused around shoulder and upper body mobility. And so we're doing a lot of work on the shoulders today. So we'll start then with our arms out here. I want you to squeeze your shoulder blades together. Your palms are facing down, okay? And you're going to do small circles like this. I'm going to keep it going for 1 minute. Okay, when you're ready. Squeeze the shoulder blades together, palms down, small circles. Good. Now just check down and make sure your feet are both pointing forwards. They're parallel to each other, so they're not turning out, they're not turning in. Good. Now keep squeezing your shoulder blades together throughout this exercise. Good. Now think about moving your shoulder within its socket. You're fully rotating that shoulder. Good. Okay, 20 more seconds. Good. Almost there. 5 more seconds. And then shake it off. I just need to turn the radiator off. Yeah, it's hotter than the sun in here this morning. Okay, right, we're going to go the other way. So now I want you to just check in on your feet first of all, about hip distance apart, feet are pointing forwards. Take your arms out, turn your palms up for me, okay? Squeeze your shoulder blades together. Now we're going to circle backwards for 1 minute. Good. Now you may feel this travel up into your neck. I will just keep going if you do. So sometimes when the movement in the shoulder is restricted, particular rotation, you start to compensate in the neck. The better you get at this, the less you should feel it in your neck. I can feel this in my neck now. Keep going. Keep squeezing the shoulder blades together. We've got 15 more seconds left. Palms are facing up. Good. 5 more seconds. Yeah, relax, shake it off. Okay, let it go. Okay, down onto the ground. We're going to go into passive butterfly. We're going to hold this for 2 minutes. So obviously this isn't a shoulder mobility exercise, but I need to break it up a little bit. Okay, soles of your feet are together. Just lie back. Oh, I've used my mic. And just relax for 2 minutes. Right, if you can't feel the stretch, maybe bring your feet in a little bit closer to your body. Make sure your pelvis is level so you're not rocking to one side compared to the other. Okay, and then pop your arms on the ground, your palms are up just a little bit away from your body, head is on the ground, and just relax. When you're happy the position is correct, just have a little look up and see, is one side different to the other or do they both look similar? So I can see my right knee is a little, I can feel it, it's a little bit higher. And these are the compensations that we keep working on. Halfway there, or 1 minute to go. Thirty seconds left. And then just gently bring the knees back together and up into a seated position. Okay, right, so now we're going to add in, go back to that position. So you're in the passive butterfly position, but now we're going to add in shoulder flexion. So your hands are interlinked like that, your arms are up in the air, and then you're gently going to take them behind you, okay, and then back up to that start position, okay, and we're going to do 2 minutes of this. I'm going to start the timer now. So your feet are touching, see if you can keep your toes touching and your heels touching throughout it. Interlink your hands, keep the arms straight, go back as far as you can, and then come up, rise and slowly. You don't need to touch the ground. If you do, that's great, but don't force anything. And what I don't want you definitely to do is to bend your arms just so you can touch the ground. And don't force the movement. So we're working on shoulder flexion here. So remember, your shoulder joint is one of the most mobile in the body, or it should be. And when you start to lose function here and you don't use the shoulder as it's intended to, that's when we start to get issues like rotator cuff injuries, which are very common. You think about the shoulders, they were designed to climb, crawl, not to just sit down all day. Shoulders should be moving regularly. For another 20 seconds here. And relax. Okay, slowly bring the legs back together. Okay, back into a standing position for me. So you've done this one before. I want you to put your hands in this position, okay? And then you're going to put this part of your hand, your fingers against your head like that, and your thumbs are pointed down, okay? And then from this position here, stay nice and tall, bring the shoulders together. What we're trying to do is move the shoulder blades like this. They should move and they should be mobile. When people can only get to here, can't get out again, lost that ability to move the shoulder blades. So we're trying to restore that. It should be a really simple, easy movement. Okay, let's go. Right, so thumbs are pointing down. And what don't want you to do, if you can't touch, is to make sure you don't lean forward to help yourself. So you just, if you can only get to there, that's fine. You just go as far as you can. If you can't do this, I would suggest that you do this daily, this exercise. Should be really quite simple. Good. If you find it easy, don't rush it. Just still keep it nice and steady. Ten more seconds. And relax, just shake the arms off. Good. Okay, back down to the ground. We're going to work on a few other things now. Okay, so we're going to do our pelvic tilts. So anterior tilt, posterior tilt, 2 minutes. I've done this many times, but it's so important, this exercise. I like to repeat it. So feet on the ground. You haven't done this before, okay? I want you to put your hands on your pelvis. Okay, all we're going to do, I'm going to start the time, because if you've done this before, you go straight into it, okay? Go. right? Is you're going to tilt your pelvis back so that your lower back flattens onto the ground. And then you're going to tilt the pelvis forward so the lower back arches, okay? And you're just going to keep doing this movement slowly. But you need to focus, as you move the pelvis backwards, I want you to focus on the glutes doing that. As you move the pelvis forward, focus on your hip flexors doing the movement. So if you come back, rather than the abs taking over, the glutes are going to take over. The abs will assist a little bit. And as you go forwards, hip flexors dominant, and the lower back will assist a little bit. And we don't want the lower back to take over. Now, if you're not sure about the hip flexors, you can lift your feet off the ground. That's your hip flexors that perform that movement, and you can feel the hip flexors work. So I always put a finger on each hip flexor, focus, then it helps me focus on the hip flexors, where they are, and what's supposed to be performing the movement. And it helps you engage a little bit more with it. Keep that going. No rush it. If you struggle with this one, trying to think about the hip flexors moving the pelvis forward, again, I would do this daily, because the more often you do it, the more you start to connect with the hip flexors. It took me quite a while to get. And relax. Good. Okay, we're going to do active frog. So if you take the soles of your feet together and just back into passive butterfly. Actually, no, don't. Start at the top, sorry. Bring the sides of your feet together like this. Now, as you go down, the feet will come slightly apart. Okay, and you're going to come back up together. Okay, I'm going to repeat that for 2 minutes. Good. That's it. Nice. So we're working through external rotation of the hips. You might feel a stretch into your inner thighs. Again, try and make sure your pelvis is level. Just under 30 seconds to go. Nice. All we're doing is just nice and gently restoring function to the joints. And this doesn't just happen overnight. This does take some repeated working on. 5 more seconds. And we recover. Okay. All right, this one then, bring your feet onto the, I can't find my words this morning, onto the bottom of your feet. Okay, your arms are just at the side here, a little bit away from the body. Just go slightly wider than hip width apart, okay? And then we're going to do this for 3 minutes, okay? So you're going to drop the legs to one side and then drop the legs to the other side. We've done this before. Good. So working on pelvic rotation, but also internal and external rotation of the hips. Now, you just have to be really careful. If you get any pinching as you go from one side to the other, you need to stop just before you get that pinch and then go to the same kind of height on the other side so that you're trying to be equal on both sides. And what you find is that kind of pinching might ease as you work through the movement, and then you may be able to work lower. But I don't want you to move into any kind of pain or pinching at all. So I want you to avoid that. Just nice and slowly. Your knee may touch the ground, it may not, it doesn't matter. Don't force anything. Once we've done this, we'll finish with a little bit of pelvic rotation work in a standing position as well. Because it's all well and good doing these on the ground, but we need the body to be able to respond in a standing position. So it's important that you do some of the work on your feet. Again, you might start to feel that you can go lower now and that pinching may have gone altogether. If it's still there, back off, back off. Nothing amazing happens when you reach the ground. Okay, we've got 30 seconds left. Pelvic rotation is so important. It's really important for walking. So many runners and athletes that I see have lost the ability to rotate the pelvis on walking because they're so tight. And that can cause obvious knock-on issues. And recover. Good, that was 3 minutes of work. Okay, we've got 2 minutes left. So we're going to work on pelvic rotation in a standing position. So let me just need to plug my mic back in. Hang on, sorry. Right. So feet are facing forwards for me. You're going to take a diagonal step forward. Okay, weight goes onto the front leg. Put your hands on your hips, and then I want you to rotate the pelvis. I'm just going to do it off the mat. It's not as stable as the ground. Okay, and then I want you to rotate the pelvis, come back to the center, and do 10 on this side for me. It's not too big a step. Make sure you're fully loading the front foot, the front leg rather. So the knee is soft, but you're not bending the knee much. Okay, good. And don't rush the rotation. Good. You can pivot on the back foot, that's fine. Back in here and switch sides when you've done that. Hey, 2 minutes went really quickly. What happens? We're going to do, after this, we're going to do one more set on each side, and then we'll finish. Do you feel any difference from side to side? Does one feel more restricted than the other? Good. Walking itself helps restore pelvic mobility as well if you walk correctly. Okay, and then let's do one more side on each side to finish. So when I assess runners, I always start by looking at their walking, see if they walk correctly. Because if you walk correctly, the arms do what they should do, and the legs do what they should do, then you should naturally start to restore pelvic rotation. Good. And one more step on the other side. Make sure you get your weight over that front leg as well. Good. You need to teach the body to be able to stabilize on one leg is really important for walking and for running. And the reason I talk about walking a lot is because it's a functional movement. It's one we should all be able to do correctly. We all walk every day. And one more. And recover. Jobs are good. Good start. Well done. Thank you.